Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to quickly go over what you should be looking at for a head-to-toe assessment. But first, if you could hit that subscribe button, it would be greatly appreciated, as it truly does help my channel grow. So let's get started. So first, we're going to take a look at neuro. So these are the things that you should be looking at: mental status, Glasgow-Coma scale, range of motion, orientation, cranial nerves, and perla. So you're going to use anything that pertains to your patient, okay? So obviously we're not going to have to assess things if a patient isn't having problems, okay? So we don't have to go through all of the cranial nerves. It's not something we have to do, but we have to use our clinical judgment, and these are the things that we have to keep in mind when doing our assessment, where we can look a little bit further. Then we'll move on to cardio. So the things that we're going to look for about the heart is obviously heart rate, blood pressure, heart sounds, and capillary refill. Then our respiratory system, we're going to look at the chest and check for symmetrical movements. We're going to percuss in a Z-block method and listen to lung sound. Next, we have the renal or kidneys. We're going to check for urinary output, make sure they are urinating, the urine color, consistency, make sure there's no bladder distension, and their current voiding method. So how are they voiding? Then we go on to gastrointestinal. We listen for bowel sounds, we palpate, we look at their diet, stool, their quality, frequency, appearance. And lastly, we look at the skin. So skin turgor, color, temperature, making sure it's dry, intact. Is there any edema? Are there any wounds? And then we would take it further from there. So these are all the basic things that we are going to look at. And then if we need to kind of dive in a little bit deeper into specific things, that's what we do. But these are the basic of what we should be looking at when we're doing a head-to-toe assessment on a new patient. So that's all I have for this video, guys. I hope you did find it helpful in your practice, and I hope to catch you in my next video. Bye for now.